the chapter of growth and development. Today we will discuss about a preterm baby. Preterm baby is a prematurity, also called as a prematurity. What is a preterm baby? The definition: baby born before 37 weeks of a gestation, born between a 20 to 37 week of gestation, and the normal birth is taking a 38 to 47 weeks. The baby is born before 37 weeks, that we can call preterm baby. What are the category of a preterm baby? Is extremely preterm, less than 28 weeks, the baby born with less than 28 weeks. Very preterm, 28 to 32 weeks. Moderate preterm, 32 to less than 37 weeks. And what are the main important things? The causes or etiology of a preterm baby. There is a classified into fetal factors, placental factors, urine factors, maternal factor. First we discuss about the fetal factor. What are the fetus in the condition of fetus and the preterm baby? Preterm delivery can be done. The fetal distress, when the fetal is distress in the gestational period, and multiple gestation, the mother conceive more than the mother is conceived the more than 2 babies in a uterus. The multiple gestation can cause the preterm baby. Erythroblastosis fetalis, if there is one of the main condition, they cause the preterm baby. And the excessive breakdown of the RBC. What is erythroblastosis fetalis? Is the excessive breakdown of the RBC when the rupture of placental, it can cause the mixing of a maternal and fetal blood. It can mother antigen, when the mother antibodies are released when during the mixing of a fetal blood, it is called erythroblastosis. Next one is the fetal factors. Placental factor, placental dysfunction. The placental dysfunction is the placenta is a normal oval shape. It can there is a dysfunctioning of a placenta, can cause the preterm baby. Placental previa is a main and common cause for a mother. The placenta is completely covered in the cervix. So placental previa is an important condition. The abruption placenta is there is a detachment of the placenta. The abruption of the placenta, there is a detachment of the placenta. Next one is a uterine factor. Due to the uterine, the preterm baby can occur. Bicornuate uterus, there is in the normal there is only one septal. There is no septal in the bicornuate. There is septal occur, can having a both babies in a uterus can be separated by it can cause a preterm. And incomplete cervix, the cervix not strong to hold the fetals. When the cervix is not held to fetus, it can lead to a preterm gestation. And the maternal factors is what are those? The preeclampsia is a gestational hypertension, and during a pregnancy, mother can go into the hypertension that can cause the preterm baby and the prematurity. Chronic medical illness, when the medical illness and the trauma can occur into the mother. The infection, intrauterine infection and intrauterine infection can cause the preterm baby. The drug abuse, when the mother can consume the alcohol and smoking, that can cause the preterm baby. The other factors are premature rupture of membrane, and the rupture may be prematurity of a membrane. The polyhydramnios is the excessive amniotic fluid, and the excessive amniotic fluid then can pressure into the cervix. The cervix can be dilated. The iatrogenic intermedical infection when during the preparation and the nurse cannot maintain the sterilization, that can cause the preterm baby, and the trauma and the fall down and accident, these are can cause the preterm baby. Next we can discuss about the assessment of gestational age. How we predict, how we assessment of gestational age. The nurse should know about all this assessment. First one is assessment of a gestational age by the baby can be done by using a new Ballard scale. It is one of the scale to assessment of a gestational age. This scale can be used for a neonatal born between a 20 to 28 weeks of a gestation. The new Ballard scale for only who are born between the 20 to 28 weeks of a gestation. It including a 6 neuromuscular marks. What are those? The posture, how the baby's posture can be predicted after the delivery. We should know about the posture, and a square window. Square window is the degree of wrist flexion. How the baby can flexion of the wrist after the delivery, and arm recoil. Arm recoil is a degree of a knee flexion. Baby is how much degree flexion of the knee. Nurse should know about, and assessment of the newborn, and a scarf sign. Scarf sign is the extend infant's arm across the chest to opposite shoulder. The scarf sign is important sign to nurse should assessment of a children's, how the child can across the how children across the elbow to the chest in opposite shoulder. The heel to ear extension, it is more common. The nurse should know about the premature baby. The heels can touch to the ear. It is one of the assessment. Next one is 6 physical characteristic. It is also main important. The nurse should know after the delivery a skin texture. In normal skin texture is a pinkish color and smoothing. In the preterm baby, the skin is it is not smoothening. It is well developed. It is not that much developed. It is very thin in texture. Lenovo is an important characteristic of physical in the preterm baby. The hair on a baby's surface of the body, the hair will be hair on the growth of hair will be seen in the baby's body surface. The plantar crisis, what are the plantar crisis? We are shown in the picture, and dry and weakness of a form and a plantar. The dry and wrinkling can be seen in the form and a plantar of the baby, and a breast nodule. Breast nodule can be seen in the so many babies. The breast is not less than the 5 millimeter. The ear firmness is a soft shine and absence of a cartilage and auricle. It is not, there is some of the holes we can see in a pic. And genital, the nurse should know of the genotype and female of the baby. Next is important about the characteristic of preterm baby. What are the characteristic of the preterm baby? Is weight is less than 2.5 kg and length is less than 44 centimeter. The breast nodule is not more than 5 millimeter wide, or it may be absent. Absence of a testis in a scrotal sac. In the male condition, there is absence of testis into the scrotal sac. The labia majora widely separated in a females. It is one of the most common characteristic of a preterm baby in the female. In a characteristic of preterm baby in a male is the absence of a testis into scrotal sac. Next one is nails are short and deep creases are absent in the sole of a feet. It is one of the more characteristic of in the both male and female. The nails are very short. Less than 35% of O2 oxygen by mask. The nurse should give oxygen to the baby with the mask. Give a 1 mg if the weight is more than 1 kg, or the 0.5 mg if the weight is less than 1 kg. The vitamin K be intramuscular injection. Why we vitamin K can be given to the anticoagulant. It is intramuscular given. The where we given intramuscular IM. The lateral aspect of the where we give the injection is in lateral aspect of the middle third of the thigh. What is the muscle name is a vastus lateralis muscle. We can see in the pic. Give a neonatal intensive care unit. Nurse should know the intensive care unit and a protocol. Keep the baby in a warm device. The radiant warmer. After the delivery, the nurse should keep the warmth of the baby. Additional 20 to 30 ml per kg per day fluid in phototherapy. Additional, we should give the phototherapy to the patient, to the baby to maintain the hydration of the baby's skin. These are the preterm baby or a prematurity baby. We can discuss all those steps. It is important in the marks, important in the exam, the competitive exam. We should know all these points. I think you should understand this point. If you any doubt, please comment. Thank you.